Hello everyone, welcome to my YouTube channel. So today we are going to learn about pediatric nursing. So the very first topic we will see in pediatric nursing is the integumentary system. So in integumentary system, first disease condition we will see is eczema. So eczema is also known as contact dermatitis. So what is eczema exactly? It is a superficial inflammatory process involving the epidermis. So which organ is affected? That is epidermis. So there are many types, some of which include atopic dermatitis, contact and stasis dermatitis. It is always associated with family history or allergy or asthma or any allergic rhinitis. So the major goal of management is to relieve the pruritus, because a patient with dermatitis will always complain about itching. So we have to relieve the itching, and you have to lubricate the skin, reduce the inflammation as well as prevent and control secondary infection. So this is the primary infection which can lead to secondary infection. So at the end we will see some forms of eczema. Before that we will see how do you assess a patient when that patient comes in OPD. How do you assess that it is a eczema patient? So first you complained of redness, then scaliness over the skin, itching and minute papules. Now minute papules may be firm, elevated and less than 1 centimeter in diameter, or it may be vesicles also. Vesicles may be fluid filled. Next is weeping, oozing or crusting of the lesions, like some fluid is coming out of the lesions. Then lesions can occur on scalp and face in infants. Creases of elbows and knees, which are the folds. Then neck, wrist, ankles or creases between the buttocks and the leg. Then we will see the intervention. What do you give this child to relieve from all these symptoms? So first is bath and moisturizers are important. Then what do you have to keep in mind is bathing water should be tepid. Tepid, that means tap water. And the bath should be limited to 5 to 10 minutes only. And the skin should be moisturized. Immediately after the bath, a thick cream or an ointment should be used, such as a petroleum jelly like Vaseline. So what will you tell the client? To have bath with tap water for at least 5 to 10 minutes, and after you bath you have to apply moisturizer. Then topical medications as prescribed, they should be like applied within 3 minutes of bath. Then antihistamines the doctor will prescribe, or topical corticosteroids may be prescribed. Corticosteroids are applied in a thin layer and are rubbed onto the area thoroughly. Then antibiotics may be prescribed if there is any secondary infection, then only antibiotics will be prescribed. Then you have to avoid exposure to the skin irritating such as soap, detergent, fabric softeners, diaper, wipes and powder. Cool and wet compresses applied for short periods may help soothe the skin to alleviate itching, pat skin dry between cooling treatments. Then you have to prevent or minimize scratching, so avoid scratching. Keep the nails short, clean and place gloves or cotton socks over the hands. Then you have to eliminate conditions like increased itching such as wet diapers, excessive bathing, ambient heat, woolen clothes or blankets, and rough fabrics or furry stuffed animal. Exposure to latex should be avoided because this will lead to allergy. Then instruct the parents to wash clothing in mild detergent and rinse thoroughly. After putting the clothes through a second complete wash cycle without detergent, minimize the residue remaining in the fabric. So all the residue which we are using, that should be completely removed. Then you have to instruct the parents about the measures to prevent skin infection, and instruct parents to monitor lesions for signs of infection. So how will the lesion be? Honey crust colored with the surrounding of erythema. Erythema means redness, and to seek immediate medical intervention if such signs are noted. So this is a warning sign given. A child with integumentary disorders need to be monitored for signs of either a skin infection or a systemic infection. So skin infection may be due to any systemic infection also. So parents need to look for those infections. So I hope you understood about eczema. So next topic we will see in the next class. Thank you.